Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
This is Lindsay Smith-Rogers, producer of Public Health on Call. Today, we kick off our election series where we look at what's at stake for public health with the 2024 presidential election. In today's episode, we explore global public health and the potential implications of each administration when it comes to the U.S.'s involvement with institutions like the WHO, funding of initiatives like PEPFAR, and how approaches to domestic health can have tremendous impact on global health. My guest is Thomas Bollyky, an expert in health policy law and the inaugural Bloomberg Chair in Global Health at the Council on Foreign Relations. Let's listen. Thomas Bollyky, thank you so much for joining us on Public Health on Call. Let's start off. Can you tell us a little bit about your work with the Council on Foreign Relations?
Sure. I direct the Global Health Program at the Council on Foreign Relations. The Council itself is a membership organization. It's a publisher of Foreign Affairs magazine, but it's a think tank. It's a policy research institute. So we spend a lot of our time doing policy-relevant, rigorous research to try to explore the intersection and advance the use of U.S. foreign policy and national security to improve global health and the safety of Americans.
Well, then you are absolutely the right person to have this conversation with. We are coming up on the U.S. presidential election. We're looking at global public health, and there are implications and proposed key efforts of each administration. Let's start off by talking about some of the direct implications that we could be facing with this election.
Great. Well, first, I want to acknowledge that historically, global public health, has played a fairly modest direct role in U.S. elections. And that's because there's been a fair amount of bipartisan alignment. After 9/11, the anthrax attacks of 2001, the outbreak of SARS in 2002, there was a broad political consensus that naturally occurring and man-made biological threats posed a risk to U.S. domestic security, national security, and our foreign policy interests in allies and trading partners. This was, of course, also an internationalist moment in U.S. history where the U.S. didn't face any geopolitical allies. Russia was reeling after the collapse of the Soviet Union. China was not the economic power it is today. Democracy was advancing globally. And there was broad bipartisan support for the historic global health investments made during the George W. Bush administration on HIV, malaria, and TB. And subsequent administrations, President Obama, and really even actually for most of former President Trump's term, there was an effort to maintain that legacy, even if they didn't always expand on it at the same rate that we had seen during the Bush administration. What started to break that down was the rise of geopolitical and economic rivals, concerns for the U.S. middle class, and this need to justify U.S. investments in what they deliver domestically. So the American First doctrine for President Trump, but even for President Biden, this notion of a U.S. foreign policy for the middle class. What are we delivering to everyday Americans? And then most notably, of course, there was the politicization of the pandemic, and where pandemic preparedness and response and public health in general was politicized as a threat to American way of life, liberty, and the pursuit of happiness, rather than just the way that we protect our national security, our economy, and individuals and communities. And with President Trump, you'll see in this election, some of the big differences fall into that politicization. A promise to withdraw from the World Health Organization if elected, a position that investments in pandemic preparedness and public health for the purpose of responding to health threats is not useful. There was an interview in Time where the former president indicated that, it really should just focus on the response once it happens because there isn't much that public health can do beforehand. It's not just a matter of the former president. 49 Republican senators signed on to a letter saying the U.S. should withdraw from the negotiations of a global treaty, the pandemic accord, and should seek fundamental reform to change the World Health Organization. So it goes beyond just former President Trump. The Biden administration, though, you've seen some changes too, where this administration has proposed cuts to PEPFAR funding and has shifted an attention away to some degree from some global health investments. There's been a reluctance on politicians in general to talk about it. So definitely more dramatic on one side, particularly as it relates to multilateralism, but there may be changes afoot to global health no matter who wins this election from a direct perspective.
This sounds like a unique time then.
Every election, you'll find people in think tanks saying this is an inflection moment. Whatever my issue is really on the ballot in this election. You should be paying attention. I can sincerely say for global health in this particular election, it's true. A big part of how global health operates is, of course, in concert with other nations, and multilateral institutions are a big part of that coordination. This question of how we invest in public health domestically, how we engage in these international institutions to try to coordinate the response of other nations is very much, you do see a new divide. This bipartisan consensus that has existed around global public health really for 2 decades is gone.
Would you say that regardless of which administration we go into in 2025, this is the fact that this is, as you say, sort of an inflection point, does that impact our relationships with some of these global health institutes?
It really does. I spend a lot of my time traveling internationally, engaging with foreign leaders and people at these multilateral institutions. It's the first and last question everyone has, which is how will our alliances, our investments, our priorities change in this election? And that's understandable given the starkness of some of the differences that we might see.
So let me pick up on one thing in particular. Let's talk, for example, about the U.S. participation in, say, the WHO. How would that, in this specific example, play out with each administration?
Yeah, so some listeners may remember, during the pandemic in 2020, President Trump, out of frustration for the perception that the World Health Organization was too accommodating of China, too slow to respond, decided to put in a notice of withdrawal from the World Health Organization that the U.S. would withdraw. Now, that didn't end up having a lot of immediate impact because there's a 1-year waiting period. That's how the treaty is designed. And it never went into effect. First day in office, President Biden withdrew that notice, so the U.S. never actually withdrew. It caused at the margins maybe some delays around U.S. payments, but we had largely paid our assessed contributions for that year. So even from a money perspective, not much flowed from that. That, of course, would be different with the 4-year term. And the president has been clear that he does intend to withdraw from the World Health Organization. So that's one immediate difference. We've established a number of offices and institutions and intended to try to coordinate the U.S.'s activities both internationally and domestically, a global public health emergency, most notably the new Office of Pandemic Preparedness and Response Policy at the White House that's congressionally mandated. Former President Trump, in that Time magazine interview that I referenced before, viewed it as pork, that this was a waste of money. Because in part, again, that the assumption that we cannot effectively prepare for these emergencies. We can really only focus on the response once it happens. That's a very different perspective than has been offered by Biden officials and is presumed to be the same set of policies that a President Harris would continue should she be elected.
As part of a Harris administration, do you think that there's some relationship mending that needs to continue to happen?
I think there is. I do think that there's a lot of hard feelings over not just domestically about what happened in the pandemic globally. There are real concerns about how long countries, particularly in the African region, had to wait for vaccine supplies to be shared. Those concerns have reemerged over the Mpox, or your listeners may know as monkeypox, outbreak that is currently happening in the Africa region, where once again there has been a call for donations of vaccines. The Africa CDC has requested 10 million as what it needs to respond effectively to this outbreak, which has been declared a public health emergency of international concern. So far, more than a month since that declaration of emergency has been made, they've only received 260,000 of that 10 million. And there have only been pledges for just under 4 million, so considerably short. It's not clear how large the stockpiles of nations are, but it's clear that nations are sitting on a fair amount of Mpox vaccine supplies that are not being donated at this time. So these tensions do exist. I think no matter who wins the election, we are at an inflection moment in global health where it's important to be able to articulate what this is delivering in terms of addressing U.S. concerns that we have now. U.S.'s foreign policy as it exists today, as opposed to what it existed 2 decades ago. And I think that will have to happen under either administration. That said, under one administration, a second Trump administration, it is quite clear that the multilateral piece will be minimized out of that. And that will not happen under a Harris administration. So that's a clear difference.
Let's also talk about some of the indirect implications. We've talked about relationships with global health institutes. We've talked about funding. What about things like vaccine conspiracies? What about things like criminalizing abortion? These are all very impactful aspects that may not have direct policy implications, but are certainly very influential nonetheless.
So for those listeners that are more global health focused than domestic health, it may not seem obvious how the U.S.'s politics around its domestic health would influence its global engagement or global health more generally, but it does. There's a long record of this. So the problems the U.S. takes seriously influence at home, influence how it pursues those same issues abroad. The clearest example is HIV/AIDS, where the fight for effective treatment in San Francisco, Los Angeles, New York, and across the country 2 decades ago created this fierce activist community that, together with international counterparts and sympathetic policymakers, were able to fight to extend the same hard-won antiretroviral therapies to sub-Saharan Africa and other nations as we had domestically. You had ACT UP, the AIDS activist group, showing up at Al Gore's campaign launch event in New Hampshire with banners about how AIDS kills and how a Gore administration would need to take AIDS more seriously abroad. This domestic constituency really influenced what the U.S. decided to invest in internationally. Another way that matters and would matter in this election is our federal public health agencies. The NIH, the CDC, the FDA, these are all domestic agencies created to address domestic needs, but they actually play a central role in many multilateral efforts, from supporting international research to working with counterparts on training to setting standards. In many of their fields, the FDA, the CDC, for all the domestic criticism they might receive sometimes, they are really the gold standard internationally. And the ability to play that leadership role makes a material difference in how problems are addressed abroad. But just as important about what the U.S. does take seriously at home is the issue of what the U.S. does not always take seriously at home. And here, this point that you referenced about reproductive health really comes to bear. You see one of the big areas where an election matters is the shift in our support for reproductive health globally. So administrations that really seek to ensure women's reproductive needs at home tend to be more supportive of similar efforts abroad. So to put some numbers to this, U.S. development assistance for reproductive tends to increase during Democratic administrations. So during the Obama administration, the Biden administration, it increased 56 and 47% respectively. So 56 across the Obama administration and 47 across the Biden administration, while it declined 42% over President Trump's term. This is a real way that how we feel about reproductive health domestically ends up projecting out globally.
The Mexico City policy comes to mind here. Could you talk a little bit about what that is?
Indeed. So the Mexico City policy was originally implemented by the Reagan administration, and it blocks the funding of organizations that provide counseling on abortion. That tends to fluctuate with the political party. To be clear here, under no administration can U.S. funds be directly used to support the provision of abortion. The question is whether or not use of other funds by those organizations can be used to support that type of reproductive health. And that tends to vacillate with the administration. And you see this pattern in Republican administrations. Mexico City policy is enacted and withdrawn in Democratic administrations. And you will see that pattern here. The one additional wrinkle for this particular election, of course, is PEPFAR writ large. As I said in the outset of the interview, PEPFAR is a program that really, it was born in a Republican administration, has really enjoyed bipartisan support. Last year, the Biden administration was only able to get Congress to reauthorize it for 1 year. And that 1 year reauthorization was because of concerns that had emerged from an analysis done at the Heritage Institute that was picked up by some members of Congress, raising concerns about this broad issue of how HIV funding is used to support reproductive health and whether even under the Mexico City policy, that's enough in terms of trying to restrain the use of it to support family planning and other reproductive health services. So here too, if the election result will matter in terms of the ability to get PEPFAR reauthorized, you may see something that goes even beyond this vacillation of the Mexico City policy, where you need to see a fundamental restructuring of the PEPFAR program in order to get it reauthorized under a second Trump administration.
I really appreciate that you've pointed out to us that, while we're looking at a domestic presidential election, this really does have huge implications for global public health and how the way we think of things at home affects the way we do things in the world. Just to close us out, could you kind of give us maybe a little forecast of what we might see immediately in the first, say 60 days of each term?
Global health has tended to be an area where presidencies do you see a lot of early action from a symbolic standpoint. So whatever we see on the Mexico City policy, whatever we see in terms of WHO, all of that is likely to happen really in the first 60 days of an administration. So if it is a second Trump administration, those actions will come quite early, and we will see the signal there. What I would be looking for is to see how deep that is going to go. Now, again, during the Trump administration before, there was support for PEPFAR and for other programs. That was all prior to the pandemic, and how that really lasts under this more politicized moment will show how deep and fundamental those changes go. And we should see that quite early under a second Trump administration if that's what happens.
Well, Thomas Bollyky, thank you so much for joining us and for this breakdown. We really appreciate it.
My great pleasure. It was really fun to talk to you. Thanks for having me on.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Grace Fernandez-Ciceri. Audio production by J.B. Arbogast, Holly Cardinale, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production management by Catherine Ricardo. Social media run by Grace Fernandez-Ciceri. Analytics by Eliza Rosen. If you have questions or ideas for us, please send us an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.